Right. Hello and welcome to another episode of Healing Conversation. My name is Einav from Untangled Coaching, and here with me today, Desiree Argentina. Hi, Desiree.
Hello, thank you for having me today.
It's so wonderful to have you. And the topic of conversation today is one that I am particularly excited about. But before we get started, please introduce yourself.
Yes, hello. So I'm Desiree Argentina. I'm a licensed clinical social worker. And for many years, I worked in an outpatient mental health clinic on the children's team. So I worked with kids, teens, and their families between ages of 5 and 19. So that was doing individual and family therapy. And now I provide the mental health services to students in a middle school and high school.
Yeah, wow. And we were just having a little bit of that conversation beforehand to say how incredible this work that you're doing. I mean, of course, we all know mental health is very much with adults, but just as much and even more serious or important with kids and teens.
Right. Right. Yeah, absolutely. And it actually, the sooner you address these mental health concerns, the better, because kids that go on with untreated mental health issues, mental health concerns, or mental illness, that does impact them as adults. So you do want to treat these things the earlier, the better to prevent any sort of severe impact on their lives as adults.
Yeah, and so the first question that I have, which I'm quite curious about, is of course when we are adults and we have mental health issues and challenges, we kind of know to understand that this is what we're going through. But what do you find about the kids and the teens that, maybe of course, they're still new to all this idea. How do they know to diagnose? I'm saying diagnose, I don't mean diagnose, but how do they know to understand what is going on? And also, how does that impact their families? Because I imagine that there's still some stereotypes and refusal to recognize from the families as well.
Yes. So I think in a lot of ways, kids and teens are more aware of their mental health because a lot of schools have taken a lot of initiative to
Right.
address mental health and have social workers, have counselors in the schools. They have programs. All schools pretty much, I know in Colorado, I don't know about other states, but I think that they all have mandated suicide prevention programming. So they talk about depression and anxiety and things like that. So I think the kids are pretty aware, maybe even more so than adults sometimes. And kids and teens seem to be more open about it. They don't really have as much stigma around their mental health as adults do. I think they're very open. They'll tell me, oh, I'm struggling with anxiety, or oh, I have all this trauma. And they're very open to talking about it. And oh, I have my therapy appointment after school. So they're pretty open about their mental health and
Mm.
the things that they're doing to improve their mental health. But yeah, you brought up a good point of parents kind of um, impeding that process. So, there's only so much that we can do in the school system. So, we very often, me and the other social workers, we very often call families and say, hey, like your kid is struggling. I recommend that you put them in therapy. And a lot of times the parents will say, no, not my kid. My kid is fine. They're acting out for attention. They're just trying to get out of class. They've never mentioned this to me. So a lot of times that is a struggle that the families either don't take the mental health seriously or they don't believe their child. So that is a struggle that we face a lot when it comes to the guardians.
Yeah, I can imagine. I guess also that this conversation might come a little bit out of the blue. So
Yes.
although you might be more aware of it because of conversation that you've had with the kids, maybe for the family is a little bit more surprising. And I guess also from the kids' point of view, sometimes they would probably not want to mention it to the family, I guess.
Right. And I think that, a lot of times we call the guardians and we say, hey, your kid is struggling. And they'll say, well, they never told me. And they'll be a little aggressive about it. And I'm thinking, well, yeah, I mean, I could see that why they wouldn't want to mention it. A lot of parents don't take their child's mental health concerns seriously. They often think it's an excuse or that it's a phase and it will blow over. But, suicide is now one of the leading causes of death in teens between 12 and 19. it's one of the leading causes of death. So it is very serious. Anxiety and depression is on the rise. And while there may be some kids that may use it to get out of things, I think that's, less of a case. I think that kids are being more open. And I think you're right. Like the dynamic at school, it's different. We are very open and supportive to the children, to the teens. So I think that they know they can go to us to talk about these kind of things. And maybe they're scared of their parents' reaction. Maybe they think their parents won't take them seriously. Maybe they're nervous about their guardian's reaction. So, we often, sometimes the kids will ask us to call their parents and we still get that reaction. So a lot of parents or guardians will say that, well, I don't see that. They've never told me they're struggling. We hear that all the time. And I think it's very common for kids and teens not to feel comfortable going to their guardians with this kind of information. It's very vulnerable. It's being, having to be very honest and open. And I think that sometimes kids get nervous and scared about the reaction, and sometimes that's justified.
And so, because you said you might ring the guardians, as you said, you would recommend therapy for the child, but do you also deal with the children at the schools, so that they're away from the house and the therapy that they might do afterwards?
Well, so we do mental health services in the school, but we just don't have the capacity to, like, I work in a middle
Mm.
school and high school with 1,000 students. We just don't have the capacity to see all these students one-on-one every week, every, few days. So we do always recommend outside services as well, just because we just don't have enough of us at the school to serve all of the students. But of course, we do meet with the students all the time about their mental health. It's just we think
Yeah.
they need a higher level than we are able to provide. So we are hopeful that the parents will help provide that. Some do, definitely, but it's a challenge for sure. And you and I were mentioning too before we started recording that a lot of places have very long wait lists. So it's hard when you get on a wait list. And I used to work at the outpatient mental health clinic. We had wait lists, and sometimes a few months will pass, and if a child is in crisis, they need help now, and that service just isn't available. So it's really tough. I think we don't have enough mental health services for the level of need that we have.
Yeah, and this is the same. This is echoed definitely in the UK as well as in the US, and of course I know about some other countries as well. Yeah, over here I know of some kids that, yes, like you said, the waiting list is just too huge. I also know a lot of the time that the kids themselves will, at least in the kids that I know, that they're really worried about going, being vulnerable at the school itself, like knowing that their friends or someone will know that they're going to have this conversation. So I'm encouraged with what you were saying, that actually the kids and the teens, they're more aware of it, and maybe things have changed since things that I've known from before about these fears of exposing themselves in some way to the vulnerabilities. Um, yeah. So tell me a little bit. What do you do? How do you deal with the mental health, and especially with the teens and kids?
Yeah, well, it definitely depends on the child, on the teen, and obviously, in the different environment that I'm in. So, one of the most important things is the relationship. You want to really show that child, that teenager, that you are somebody they can trust, that you're somebody that validates their feelings, that you're somebody that believes them, that you're somebody that can provide that emotional support to them, and just somebody that they can talk to and feel safe with. So the relationship, especially for teenagers, is the number one thing. Because I feel like kids just always love you, when, they just, if you pay attention to a kid, they just love you. That's easier. But teenagers, you really need to earn their trust, and they need to know
Mm.
that you're somebody that they can trust. So building the relationships with the teens is the most important thing. And a lot of teens, when I worked at the mental health clinic, they did want to come into therapy, but there were some that didn't, that their parents or guardians made them come in. And after a few sessions, they loved it because they saw that it was for them, where that I'm somebody, us on the team, we're somebody that is going to provide that support. This is for you. This isn't just to appease your guardian, I'm really here for you to help you. So a lot of the teens really loved coming, and they would even sometimes bring in their friends or bring in their boyfriend or girlfriend. And so it was really nice. They really felt like it was a safe space for them. And I think that's the most important thing. And that doesn't just go for me as, a mental health provider, that goes for parents. I think it's so important that guardians need to know, to let your child know that you are somebody they can trust, you are somebody they can talk to, and you are somebody that will support them and validate their feelings and be there for them. And I think a lot of teens doubt that sometimes. They don't know if their guardian will believe them or that they can trust their guardian. So I think that that's very important for guardians to know that, your relationship with your child is one of the most important factors in their mental health, and having them have a healthy well-being. I think it's very important.
But I think it's also, it really, because of course I know from myself and my kids, and also my clients, and what they share with me. And sometimes if the parents have a good relationship, then it feels very, nurturing, and okay, this is something that we are going on together. It's like our joint journey. But there are still, parents out there that this conversation will never happen, because they have maybe, yeah, teenagers sometimes can be really challenging, and so parents might not feel that they have this ability to even bring the subject up, to see how to support you. Sometimes if you have a teen that is really angry and frustrated, it's actually a real challenge to bridge that gap.
It is. It's very challenging. And I think a lot of times it's hard for guardians to know, because so many of the mental health things to be aware of and to look out for, the symptoms, can look very similar to just having a moody teenager, right? So
Yeah,
looking for, major changes in behavior, major changes in sleep patterns, in eating habits, and that isolation. A lot of those things can look like just a typical teenager. So it
yeah,
can be very hard. And I think a lot of guardians, like you brought up, can almost be scared to approach their teen. And I totally get that, because teenagers can be unpleasant. And I think that a lot of teenagers know that their parents deep down are a safe space. So they do release all their anger and all of those emotions out on their parents. And I think in a way, because they know that their parent is a safe space. So, not that that's a great thing or that the parents, deserve that, but just knowing that, hopefully your teen knows that you're a safe space. And I would say, if you are nervous to bring these things up with your child or your teenager, it doesn't have to be a lengthy conversation. It could just be, hey, I feel like, I've been seeing some changes in your mood. And if you're struggling, just know, like, I'm here if you want to talk. Just having that open invitation, letting your child know, hey, you can come talk to me. I'm a safe person to talk to.
yeah.
Just letting them know that in just a simple sentence. And if they yell at you, curse at you, whatever, you did your part, and, you can't control their reaction to that. They may say, you're being dramatic. There's nothing wrong with me, blah, blah, blah. But letting them know, hey, I'm here if you want to talk. And they may take you up on that.
Yeah, yeah. No, I like that actually. And I think I recognize, I guess, from my own time growing up, that yes, I remember about me definitely thinking I was all alone, and not really considering that actually, I could speak to my parents until later on when I knew that I could. But it was definitely a journey. And
Right.
yeah, and the moody teenager, yes, I definitely, I identify with that. Kind of the challenges of noticing, of knowing actually why are they being so moody? Why is it just being teenagers, or is it something more, serious going on? So
Right.
what are some, like you mentioned, some of the symptoms already, right? Like change of mood and change in sleeping and maybe eating habits and stuff. But what is it that we're looking for if we're wanting to support our children or teens?
Yeah, well, I would say to guardians that, you know your kid. If you have that feeling that something is off, don't, push that aside. Really pay attention to that feeling. One big thing is there academic performance. If they have big changes in their academics and their grades, that's also a sign.
Mm.
If they lose interest in things that they used to love, and that's again a hard one too, because as you're growing up, you may find different interests. You may lose interest in some things. But if they used to, be a great artist and, would love art, and now all of a sudden they don't want to touch it. And is that a change in interest, or are they feeling depressed? Are they isolating and only in their room? They don't want to spend time with friends. I would say pay attention to also the way they talk about themselves. So if they say, oh, I'm so stupid, I'm so ugly, I'm this, pay attention to that self-talk, because that's also a big indicator that something is going on. And also, social media is a big thing. Try to, see what they're posting, their kind of captions, the kind of messages they're posting, the kind of pictures, their stories. Pay attention to that, because a lot of teens use social media as an outlet, almost like, a live personal diary. So just be paying attention to that, what they're following, the kind of content they're consuming. All of these things are very important to pay attention to.
I'm just thinking, I have no idea.
And a
You
lot of
know,
parents don't. That's the thing. A lot of guardians have no idea. So if you can, follow it, and again, depending on the age, if you have a young kid that's on social media, like 10, 9, 8, make sure you have those passwords. Make sure you're logging into their accounts. I know a lot of, guardians on here are going to say, oh, that's ridiculous that, kids shouldn't have social media. Maybe, but they do. They do have the social media.
yeah.
So if your child does have social media, and they're young enough for you to have the passwords, make sure you're logging in, make sure you're using those parental controls. And if your teen is older, if they're open to you following them or looking at, what they're posting, and some teens may not be, but some teens, if you really ask them, if you say, if your teen is really interested in video games or something, and you it's really important to try to be a part of what your child is interested in. And a
Mm.
lot of kids and teens, they will be happy to share that with you. Not all, but show an
Yeah.
interest in what your child has an interest in. But a lot, like you said, a lot of guardians have no idea. I was talking with somebody
Yeah.
last year about Roblox, and I used to play Roblox with my little sister. So I have an account, and I would go on there and play the games with them. And I was speaking with a parent that said their kid is on Roblox all day, every day. And I said, oh, yeah, it's actually fun. I play it with my little sister. Like, it's great. And they said, I have no idea what it is. And I said, you don't know what your kid is on all day, every day? And they said, no. And I said, well, you might want to log into there. So, just to know what your
Yeah.
child is doing online.
Yeah. Yeah. I definitely hear what you're saying. I was just thinking, there was a time when I was, of course, following my daughter, my older one. But then I find out that, she has a secret account that is only for her friends. And then
Yeah.
she wouldn't even let her sister follow her. And it's like, oh my God, what can I do about it? But luckily we do have a very, very close relationship. And, I say luckily, of course, I have no idea what is really going on, but I think yeah, for us at least we do have that conversation. Um, so I know that for me as a mom to a teenage girl, she's 15 and her sister is going to be 12 soon. So for me, like, the idea of suicide is like probably the scariest thing in the world. Um, for me, I just start thinking about it, I start crying. It's that extreme actually. But what can we, again, the changes in behavior and everything that you've mentioned before, are we really looking for signs? Is it really about suicide? Is suicide always at the front of our mind, or is it also about really just the mental support that, of course, everyone needs?
Well, I think definitely if you're worried about suicide, I mean, your kid, your child should be in therapy. Absolutely. If that's a worry for you, if you feel like that is a risk for your child. And like you said, a lot of times we don't know, which is the scary thing, but having those open and
Mm.
honest conversations, and just, I know it's really, really hard for guardians, but saying to your child, if that's a thought, if you're scared about that, if you are concerned about your child's mental health, saying, hey, are you thinking about killing yourself? And I know that sounds just really scary to ask
Mm.
somebody, but it's so necessary because you want to open that conversation. I think that a lot of guardians would rather ask that question than be planning a funeral, just to, but if you're really concerned about your child's mental health, you need to get in contact with the school. You need to talk to the school social workers. You need to let them know that you're concerned and ask what they're seeing at school. And you need to get your kid into therapy because not all guardians are equipped to handle that. So if that is really a worry, if you're noticing a lot of troublesome behavior, a lot of behavior that's really worrying you, then you definitely need to reach out for support because it's really difficult for any guardian to handle. So
Yeah.
just having those open, honest conversations with your child and saying, I'm really worried about you. I'm concerned. And again, having that conversation. And it's a really difficult conversation, but it's very necessary. But again, providing just that support, that encouragement, that safe space for your child. And if they are struggling with their mental health, you have to seek out support for them because you can't do it alone.
But what about, like over here in the UK, there's waiting lists for everything, and something that comes from the government, and even private therapists. There was a time when I was looking for some, the waiting list. Everyone was saying, "Oh, I'm fully booked. I'm fully booked." And I guess after the pandemic, it has, this really has increased. So, what is something that a parent or guardian can do when they notice that their child is, having panic attacks or anxiety? What is it, something that they can actually do in the moment?
Yeah, that's a great question. And like you said, it's so true. There's just not enough services for the level of mental health need that we have. So
Mm.
it's tell parents don't give up. Don't call 3 places and say, okay, it's everybody's full. Keep trying. Call your insurance company. Call private providers. Again, contact the school because they'll have resources and services for you as well. Some schools have therapists that come into the school from clinics, so you could get on that waiting list as well to have therapy in the school from a mental health provider from a clinic. A lot of schools do that. I would say definitely do that. But in the moment, if you're really worried about anxiety or depression, the number one thing you could do is educate yourself. So I would say if you have a child that's really struggling with anxiety, do a lot of research, look up what anxiety, how it shows up for kids and teens. Ask your child what kind of anxiety symptoms they're having that they're struggling with. Do a lot of reading, read a lot of articles, read books, educate yourself on anxiety and how you could treat it, or whatever issue your child is struggling with, whether it's depression, anxiety, whatever the case may be. And so depending on the situation, it may be something that's more specialized, like say your teen has an eating disorder. You're going to want to go to an eating disorder clinic. And you can even, if you call around, if you call mental health clinics, if you call therapists in private practice and they are booked, you can ask them for resources. Say, I understand that you are booked, but my kid is really struggling. Do you have any resources that could help me? Any reading that I could do, anything to educate myself and my child? So you're definitely going to want to educate yourself.
Yeah, yeah, I get it. I just think that sometimes, because in my clients, which are adults, sometimes the people that suffer with anxiety and panic attacks, and it's very interesting because for adults that go through these things, they panic attack, right? Panic attack is so scary. Sometimes it feels
It
like
is.
it does feel like you're just about to die because you don't know how to handle that. And so with my clients, my adult clients, they know to recognize, they know to recognize the symptoms of when it is coming and what it actually looks like. And then they also know that really at the end of the day, if they want to change it, it's up to them. They have to do the work. But with teens that I'm in touch with, and they go through panic attacks, they don't seem to have that yet. It's like a little bit of like they don't recognize that. Well, maybe I should say it differently. Maybe they think that it is there to stay forever, and
Yeah.
so they don't have this understanding that they can do something about it, or that they need to find some, inside. strength to actually go through this. And that, because especially I think with panic, because I have seen it for myself, with teens, that it's so scary. It's so scary to be there, and you can't say anything. You can't really help. It's no like, okay, I know some tools. Maybe there's some breathing. Maybe it's about, counting colors, which I know that sometimes people can do. It's something that you can understand as an adult, as an observer, but it's not something necessarily that you can say to the teen as they're going through that. And I'm really curious if there's, what can you do if you're already in that situation where you are aware of it, so it's not like hidden. What can you do as the observer?
Yeah, well, I think there's a lot that you can do. So, say you are a guardian with a child that does struggle with either anxiety or panic attacks. Again, that is very scary to see, but there are things that you can do. So, again, with that education, with educating yourself, comes the tools, right? You'll learn the tools and you'll walk through those things with your teen. And I think it's always good to come up with a plan, come up with those coping skills, having
Mm.
that plan ahead of time. You don't want to, in the moment of a panic attack, say, all right, let me look up what we need to do, really prepare for that situation. If you know you have a child that struggles with tantrums, with anxiety, with panic attacks, you want to be prepared ahead of time. So
Mm.
again, with that education will come those tools. So for your example, say that your child is having a panic attack, getting them to a safe space, wherever that may be, sitting with them in that. And you could do the breathing with them. You can demonstrate that. You could demonstrate that tool and
Mm.
say, okay, breathe with me. We're going to inhale. We're going to exhale. Maybe getting them some ice, because ice is a great way to calm the nervous system. So getting that ice on their neck, in their hands, maybe on their face. So, again, it's going to depend on the kid. And, this is the thing, how you mentioned a child may not always know the signs, the symptoms, the triggers, what will help them. But
Mm.
that's a skill, right? You build that up. You build up that knowledge. You build up that tolerance. You build up the toolbox of what you can do. And you as a guardian can help your child do that. So that's part of a guardian's role, right? Is teaching the child. And these are things that we do in therapy as well. I can't always be there when my teen is having a panic attack. So we have to
Yeah.
talk about how we can prepare, what works for them, what doesn't, and the tools that they can implement, and builds that skill of knowing what to do. So that's something, you can't solve these problems for your teen, but you want
Yeah.
to be there because you're not always going to be there. So you want to be able to give them that, that guidance and that support so that they can get themselves through these really scary situations. So again, educate yourself, look and sit down with and if they are in therapy, you could sit down with the therapist, explain your concerns. If you want to do a family session and come up together with a plan of action and the things that work for them, the things that don't, the things that come up with a list of things that trigger them. And it may take some work and it may take some time. This isn't we're going to sit down one time and come up with, all the solutions. This is
Yeah.
a long process. And I think that's part of the, maybe challenge too for guardians, is that having that patience, that this is a process. You're not going to stick your kid in therapy or stick yourself in therapy and everything's going to be solved.
Yeah, I mean, therapy. Yeah, like I said before. I mean, I really like what you're saying about, of course, to educate yourself, and also creating that plan, which I really believe that could be very helpful in the moment, because as someone who has witnessed panic attacks, I can definitely say that it's a little bit well, scary. But I still also think that this. I mean, therapy is very, very good. I know that in the US it's a little bit different than the UK. The UK, you can get your therapy on the NHS, and it basically means that there's lots of waiting lists, and of course some people don't necessarily believe in therapy, or want to go, or don't want to send their kids, which is a whole a whole different topic. There was something that was very interesting in the UK. I remember one time, just after the pandemic, or well, the pandemic was going on; it wasn't over. Um, there was an article in one of the local papers, one of the national papers, to say that after the lockdown, about 500,000 children has not actually gone back into schools. And the interesting thing about that article was that it kind of opened everyone's eyes. People could see that their children and teens, they were struggling, and a lot of the time they would say, actually, they would have to deal with the children not wanting to go to school. And all of a sudden, that there was this kind of the national awareness. You could then see, okay, it's everyone, and every person knows someone that the pandemic has influenced their mental health in a way that was, well, shocking, and completely caught them unaware that this kind of thing can even be. So I guess I'm just saying that in what I was saying earlier about the stigma and the stereotypes of, I my kid doesn't have it, or I'm not, you know it doesn't have to be that way. But when you see that actually it's so wide, and so many kids and teens are suffering with similar things, that definitely that was helpful to show parents and guardians that actually it doesn't mean anything. Actually, if you notice that someone is suffering with mental health, depression, anxiety, panic, and just, even just they're going through emotions that they don't know how to deal with, that's okay. It doesn't mean anything other than that you need to get some help in whichever way you can.
Yeah, exactly. And I did write this down. I wanted to read these 2 points for guardians to know as well. So in 2021, the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association declared that we are in a national emergency for child and adolescent mental health. So they're actually declaring a mental health emergency for kids and teens. And according to the National Alliance on Mental Health, they state that 1 in 5 kids and teens is living with a mental health condition. 1 in 5, that's a huge number.
Yeah, yeah, and definitely. I mean, I remember, before all of that, before the pandemic, even when I was a kid, it really was about this thing that mental health sounded like something that you don't talk about, and now it's actually we have to talk about it because it's not something that we have to get out of the stigma. That's what I think I'm trying to say. It's just something that is out there, and just like some people have headaches and some people don't, and sometimes it's okay. It doesn't. We need to move away from worrying about the labels and actually start dealing with what it is that we can do to support and be there for the people who suffer. And if
Yes,
people
exactly.
are suffering, they should be able to admit it, because it's not it's nothing. It's not a bad thing. It's not a good or bad thing. It is there. Let's deal with it.
No, exactly. And mental health is health. I mean, like you said, it's just like physical health. If you have a broken arm, you go to the doctor. So it's the same thing. And again,
Yeah.
I think that, having these conversations is so important because just us here talking about it is helping to destigmatize mental health. I think that a lot more people are becoming open about it. I mean, I just met a
Mm.
girl recently and she told me she had a therapy appointment. I mean, that's huge, right? I mean, that's
Yeah.
totally people feeling comfortable saying, hey, I struggle with my mental health and I'm getting help with it. And people are becoming way more open. And I think it is, again, parents, guardians need to work on being open to having those conversations with their kids. And I know it could be a scary conversation to have for sure, but it's an important one. And I think just us talking about it and these podcasts, these conversations are really helping. And having these mental health services in school, having these, mental health programmings in school. I was a part of a fellowship called Asset, and it was so great because we implemented it within the whole school. So they were really short, like less than 10 minutes, 5 to 8 minutes of tools that we would use with the teens as a whole class, as a whole group. So
Mm.
whether it was deep breathing or, positive psychology or mindfulness, we had all these different lessons that we could go to that teachers were using with their students to just kind of, start off the class or end class with, and, less than 5 minutes. So, I think that's really great too, that a lot of schools are doing things like that. It's really helpful, and it helps to destigmatize mental health for the kids and the teens.
Yeah. Yeah. Really, definitely a conversation that needs to keep on happening. So what about you? What brought you into the idea? Because you said about social work and the therapy. What brought you into the interest of working with kids and teens?
Yeah, I kind of stumbled into it. I honestly, didn't know what I wanted to do exactly. I grew up always kind of wanting to be in a helping profession. And growing up, I didn't know what a social worker was. I had never heard of social work. So I didn't exactly know what I wanted to do, but I knew I wanted to go to college and be in some sort of helping field. So whenever I said helping fields, people would always say, oh, like you should be a nurse. And I knew I didn't want to do that. I knew I didn't want to be in the medical field.
Mm.
So I decided to just go to college for my general studies, just to get the math, science, all the prerequisites out of the way. And then I went to a 2-year community college. So then it came time to transfer to a university. And I still just had no idea what I wanted to do. And growing up, I was always, volunteering and, collecting items for, kids and stuff, and, volunteering with animals. I always had that. I always wanted to like volunteer and help people, but I didn't know how I could do that as an adult. And so I was just flipping through, pamphlets on schools and programs, just having no idea what I wanted to do. And I came across one program called Human Development. And it sounded really interesting to me, all the courses there. It was like, emotions, expressing emotions through creative writing, or it was, there was one like playback theater class, which was, you would express your emotions through like, little short, theatrics, it was, child and adolescent psychology. So, studying women's bodies, like everything sounded so interesting to me. And I was like, oh my gosh, I have no idea what I'm going to do with my life, but I'm going to that program. So I did. So I went to that program. I transferred to that school, and I took a course on the HIV and AIDS epidemic. And my professor, it was getting to be towards like graduation time. And my professor said to me, we were having a conversation, and she said, my husband is the director of a nonprofit. You should think about volunteering there. And I was like, oh, okay, sure. So I contacted him. I started volunteering, and it was in a syringe exchange program. So I started volunteering there. And then I got hired as a part-time person. And then the full-time person ended up leaving. So they offered the full-time position. So with just my bachelor's degree, I don't even know how old I was. I think I was like 22 or 21 or something. I was running a syringe exchange program, working with, substance users and trying to get them into treatment and things like that. And I really loved it. But I didn't get paid a lot, and I knew I wanted to kind of do something else. And then at that nonprofit, a bunch of social workers worked there. So I learned about social work there, and they told me all about, what I could do, and, the different capacities I could work in. And it just sounded really great. So I started looking at social work programs for graduate school. And after 2 years of working there, I went to graduate school for social work. And I really, I just kind of fell into it. And it just felt meant to be, because I love it. I love social work. And I just love that you could work in all these different capacities. I mean, I work with kids and teens now, which that I just kind of fell into also, because I had one of my friends got a job at the mental health clinic, and I was looking for a job, and she said, hey, send me your resume. I'll send it to my boss. And I said, sure. So I got an interview, and I interviewed with the director of the mental health clinic and, my future supervisor. And they said to me in the interview, they said, do you want to work on the children's unit with kids and teens, or do you want to work in the adult unit? And I was like, oh, I I don't know. I have no idea. I said, just stick me where you want me. I can't, like, I couldn't choose. So they
Mm.
put me on the children's unit. So I even just fell into that. And then I just loved it. And then I was like, oh, I can't even imagine working on the adult unit. I love this so much. So I just kind of like stumbled into this all along the way.
Amazing, amazing. You know, when things meant to happen, they happen, right? They find the way to
Right.
happen.
Right. And I
Yeah.
love it. And I love working, with kids and teens and their and families and, working in mental health. So, yeah, I feel like it was meant to be. And I always knew what I wanted to do, but I didn't know how to get there. Like I knew I wanted to help people and, try to, make their lives better, make the world a better place. But I had no idea how. I didn't know what social work was. So I just kind of like fell into where I am now. So it worked
Yeah.
out.
It works out, and it's incredible, I think, because so many people don't know what they want to do when they grow up, in a sense. And I
Yeah.
really like this idea that actually, there was, of course, there was this calling for you to help people and to work with people, but that's really what we are here for, right? We are here to work with other people and make the world a better place. So it's so wonderful that it kind of worked out for you in this way. Yeah.
Yeah, yeah. And it was, I think for people too, it was a lot of me kind of saying yes to things and taking opportunities. My professor said, "Hey, you should volunteer at this nonprofit." And I said, "Sure." And then my friend said, "Hey, do you want me to pass on your resume?" And I was like, "Sure." So, just saying yes to opportunities as they come along.
Yeah. Yeah. So tell me, just before we gonna wrap up, can you think of any success story or something that, inspiration for us all, that we can take away from all of this?
Yeah, I mean, I think like a big thing is that I think a lot of guardians feel stuck and I think they feel almost like a lot of grief in their relationships with their child because as we know when, you know, kids get older, they kind of in those teen years lose interest in you and I think that's really hard for a lot of guardians, but to know not to take that personally and your goal as a guardian is to have your child be independent from you and be a successful adult and I think that a lot of just knowing a lot of kids and teens, they do want that relationship with you. And it's something that, I think they struggle with, but, they do want that relationship. So I think, putting in the effort, putting in the time. And the thing is, you might get rejected a lot of the time, but just letting your child know that you have that, you're extending that invitation to them. Hey, want to watch a movie with me? Hey, you're playing that video game. Can I play? Hey, do you want to go for a walk? Just inviting that time, I think is really important. And even if you get rejected, not to give up because your
Yeah.
teen does care. They will appreciate it someday. They do want that relationship with you. And just to be open and honest and not be afraid of your teenager.
Yeah, I think that's really important. And I will just add that it's also, there is no judgment on you. Because I think a lot of parents, they are worried that, if they admit that their kid or teens have, mental health challenges, that it will somehow reflect on them, and it's got nothing to do with the parent. It's only really got to do with the child or the teen. And now let's be on the same team, same side, and walk through this together.
Yeah, and
um,
mental illness does not discriminate. I mean, it could be any race, any ethnicity, any any socioeconomic class. I mean, it affects everybody. So it's not your fault. So just knowing that if your child is suffering, and really struggling with their mental health, that's something that again, 1 in 5 kids and teens are. So
yeah.
just knowing that it's not exactly anything you could have done differently. I mean, mental illness is, something that can affect anyone.
Yeah. Yeah. So let's just talk about it and be there for each other.
Hmm.
Brilliant. Desiree, that's been such a great pleasure to talk with you and to learn a little bit more about what you do and about you, and really, some advice on how to help the people in our lives that are suffering, be they children, teens, or other adults as well. Thank you. Thank you so much.
Yeah.
And
Thank you.
thank you. And now, just to say for anyone watching, later on, we will add the links to your socials, so people can get in touch. Yeah, that will happen in the comments.
Yeah.
Great. Well,
Perfect. Thank you so
thank
much.
you. Thank you so much. Thank you.